All right. Good morning, everyone, and thank you for joining us today for this exciting announcement. My name is Bill Galley, and I'm the Vice President Research at the University of Calgary. I'll begin by acknowledging that we're on the traditional territories of the Treaty 7 First Nations. The City of Calgary is also home to the Métis Nation of Alberta Region 3. I'll start by extending a warm welcome to our guests. Minister Doug Schweitzer, Minister of Jobs, Economy and Innovation for the Government of Alberta is here, and he'll be next up here at the podium. Laura Kilcrease is here as well. She's the CEO of Alberta Innovates. And I'd also like to welcome my colleagues from the University of Calgary, Dr. John Meddings, who is the Dean of the Cummings School of Medicine, Dr. Kristen Bates, who is the Dean of the Faculty of Science and our newest Dean at the University of Calgary. Welcome, Kristen. Dr. Dave Hansen, who's the head of our Department of Biological Sciences, where a substantial part of the work will be done for the project we're announcing, and Dr. Ian Lewis from the Faculty of Science. And also from Alberta Precision Laboratories, Dr. Paul Klenawski is here. I also bring greetings on behalf of University President Dr. Ed McCauley, who is unable to attend, but he sends his best wishes to everyone being recognized today. The University of Calgary is absolutely thrilled to be hosting today's announcement. Investment in university research is an investment in the future of our province. Alberta is home to a robust and dynamic innovation ecosystem. It empowers our researchers to develop bold new solutions to society's most complex problems. Research leads to economic diversification and growth, and it translates to a more sustainable future for Albertans where everyone can flourish and succeed. The support being shown today by the Government of Alberta will enable these research teams to help transform our healthcare system. It will lead to better outcomes for Albertans and a potential for positive impact on a global scale. It's an exciting day for everyone involved, and we're grateful to be a part of it. Now, to get things started, I'm pleased to welcome the Honourable Doug Schweitzer to the podium for today's announcement. Over to you, Doug.
Thank you so much to everybody from the University of Calgary here for welcoming us today, and thank you to Laura Kilcrease from Alberta Innovates, and all of the professionals that are here from the university and also involved in this project to get it to this point. As a politician, whenever you get to a level of this detail and kind of scientific expertise, it's always one of those ones where you have to be a little bit mindful as to how much detail you get into the weeds on. But it's a very exciting day. And when you take a look at the work that Alberta Innovates is doing here in the health sciences space overall, a lot of people don't appreciate the development of this industry in Alberta. And it is a big economic driver for our province as well. When you look at the innovative companies that are using artificial intelligence on breast cancer scans, to everything when it comes to innovative tools as well that they're using in the medical world in space. So this is an area that we want to invest, continue to grow for our economy. And today we're announcing $6 million of funding through Alberta Innovates to 3 successful applicants in the Health Innovation Platform Partnership. We have a partnership between the U of A and the University of Calgary. We also have a NATE applicant that was successful, as well as the Institute of Health and Economics. With all of these collaborative approaches that we're taking, we're going to take ideas generated and the research done at our post-secondary institutions and help commercialize them into businesses and jobs, and also tackling long-term problems facing the healthcare system. You don't have to kind of look very far today to take a look at the impacts of artificial intelligence and machine learning in particular. When you look at the broad amount of data that we have to take a look at scans, to help people solve problems in a big, complicated way, this is an area where we're going to save money for the health system, we're going to create jobs, provide better outcomes for patients, and tackle some of the world's most challenging problems that we face. And Alberta has the opportunity to continue to lead. We have a world-leading artificial intelligence institute and learning processes at the University of Alberta. We have the Amy Institute in our province. So we can leverage all of that together with the amazing research that's happening through our health system and our post-secondary institutions to help commercialize products, create jobs, and diversify Alberta's economy. That's amazing to see, and Alberta Innovates is playing a leadership role in this regard. So thank you, Laura Kilcrease, to you and your team for helping bring this to the goal line. And I'll turn it over now to Laura Kilcrease to provide more details on the announcement here today.
Thank you, Minister. Well, good morning, everyone. This is indeed another exciting day here in Alberta. You know, Alberta Innovates is focused on putting innovation into action and to create a competitive health innovation ecosystem. That's why we launched this Health Innovation Platform Partnership Program in September 2020. We wanted to support the partnerships that would enable a digital and data-enabled health economy in Alberta that gives small and medium businesses and other enterprises a competitive advantage over their brethren elsewhere. You know, I also wish to really thank my colleague Tim Murphy and his colleague Raja Mehta at Alberta Innovates, who really spearheaded and led this program. Thank you, Tim. These platform partnerships will help Alberta Innovates overcome the hurdles associated with developing products in this field. It's not just about market fit, it's ensuring the business is ready to go into that market and complying with regulatory requirements for their product development. The projects we're announcing today have some great partners involved. The Institute of Health Economics will be working with SMEs to generate the data and economic analysis needed to develop the commercialization aspect of those technologies. NATE Center for Advanced Medical Simulation will provide a virtual testbed to advance processes and technologies. And next, we'll hear more about what the UFC and the U of A, through their ADEPT collaboration with DynaLife and Alberta Precision Labs, has to tell us of what they're doing. The three projects we're announcing today are examples of how we can enable the commercialization of digitally enabled and data-informed health decisions. Why? Digital and data-enabled technologies allowing the development of patient-focused solutions. Yes, patient-focused solutions. And at Alberta Innovates, we've been heading in this direction, shifting from just traditional methods of providing healthcare to new models of care enabled by innovation partnerships in our great cities with great ideas. We want to help put health in the hands of the people and creating and supporting a vibrant digital health sector in Alberta. So through the programs, the Health Innovation Platform Partnership, we're helping to harness the ingenuity of our researchers, the capability of our entrepreneurs who have developed these innovations and technologies, and getting them to use in the patient's hands for their own benefit. Now, I'd like to introduce Dr. Ian Lewis, who is an associate professor in the Department of Biochemistry at the Faculty of Science at the University of Calgary. He's also the Alberta Innovates Health Translational Research Chair, and he is the co-applicant of ADEPT, and he will tell you lots more about the ADEPT, the third winner of our program. We're so incredibly excited about this. Dr. Lewis, please.
Thank you very much for the opportunity to speak here today. And I'm very grateful, Minister, for being here, our deans, Dean Bates and Dean Meddings for being here, and of course our Vice President, Dr. Galley, for making this possible. So I moved to Alberta 7 years ago. I was recruited here on a translational health chair with the vision of establishing a globally competitive translational program in diagnostics. And the thing that attracted me here was a vision about integrating the health ecosystem with innovation. We have this thing that people talk about a lot here, is the Alberta Advantage. And what they mean when they speak of the Alberta Advantage is we have a consolidated healthcare environment with one or two parties having access to all of the healthcare samples and data needed in order to do very large-scale research. We have a business ecosystem that supports people who want to develop new concepts, and we have a really vibrant ecosystem of innovators here. The thing is that each of these little pieces are operating largely by themselves, and over the last 7 years, we've worked very hard to build some bridges between each of these silos to create a new ecosystem for innovation. So I'm really pleased to announce that we've made lots of progress thanks to investments from the University of Calgary and the APEX program. And over the last several years, we've brought in $14 million, spun out 5 companies, supported 28 demonstration projects. And now this ADEPT program is the most exciting extension of that because it takes this vision and it integrates all of the health ecosystems that we've been talking about into one envelope. Well, we'll launch 3 living laboratories. We'll support a large network of demonstration projects, and we'll provide a soup-to-nuts solution that will allow innovators to both access Alberta's healthcare resources, get the help they need to guide, develop new precision diagnostics, and support in order to bring these things into real-world healthcare solutions. It's really exciting to be here. We have the opportunity to create new things, implement new things, and compete globally. And it wouldn't be possible if it weren't for support from Alberta Innovates and our universities, and I'm very grateful for this opportunity. I'll be very pleased to announce our co-partners in this initiative. So we're not going at this alone. When we launched the program, there are 4 of us who got together to see if we could create this ecosystem: the University of Alberta, the University of Calgary, DynaLife Medical Labs, and Alberta Precision Labs. And it's those 4 partners that are critical in working together to create this new ADEPT model. And with that, I'd like to introduce the other co-lead for this program from Alberta Precision Labs, Dr. Klenawski, who is the South Sector Associate Director, Medical Director, to speak on behalf of APL.
Thank you, and good morning, everyone. I'm Dr. Paul Klenawski, Associate Medical Director for Alberta Precision Laboratories here in the South Sector. It is my pleasure to join everyone in celebrating this tremendous investment in turning healthcare innovations into reality. On behalf of everyone at APL and Alberta Health Services, I would like to extend our gratitude to the Government of Alberta, to University of Calgary, University of Alberta, and DynaLife Medical Labs for their support. Today's announcement will have direct impact on the lives of all Albertans. And it's fitting that the new ADEPT program will be based here at APL's Diagnostic and Scientific Center, because this facility is home to work that happens every day at the intersection of academia, industry, and healthcare, including the thousands of lab samples that come here for testing every day from across southern Alberta. Innovation in the lab environment has put Alberta's lab system on center stage through a number of collaborations like this one over the past several years. Lab tests are crucial to most healthcare decisions, from diagnosing illness to developing treatment plans and ongoing monitoring of patients' health. That's why any improvements to laboratory medicine through innovation directly benefit patient through greater precision, more convenience, and faster turnaround times for results. A great example that is familiar to most Albertans these days is our provincial COVID-19 testing program, which is one of the most successful of its kind in the world. This program is led by APL, but has only been possible thanks to the ongoing collaboration between provincial and federal governments, the healthcare system, universities, and private sector partners like DynaLife. Building a mass testing program for a virus that continues to evolve and present new challenges requires enormous effort behind the scenes to develop, test, and implement new technologies and processes that meet the needs for managing the pandemic in our communities. APL is pleased to be part of the ADEPT partnerships, as it provides a strong and dedicated platform for us to support Alberta's innovators' access to the controlled testing environments and the expertise of our laboratory scientists and operational staff in order to transition their innovative ideas into tools that can be used in the real-world laboratories. This approach will ensure the diagnostic tools developed are aligned with the unique needs of Canada's healthcare system and the and that Alberta patients are the first to benefit from these new homegrown technologies. APL's tagline is Leaders in Laboratory Medicine, and we look forward to working together with all of our partners to continue living up to that slogan. Thank you.
Thank you. That brings us to the question and answer portion of our event this morning. All of our speakers here this morning are happy to take your questions, and so reporters, if you can identify to whom you're addressing your question, and you'll have one question and one follow-up. Operator, can you put through the first question, please?
Dave Kaiser, City News.
Mr. Schweitzer, sorry to start it off with an off-topic question here, but just curious, you were Justice Minister when you helped create the Critical Infrastructure Defense Act, and at the time said it would help stop protesters from harming the economy and blocking people's access. So curious, is the situation in Coots exactly the type of thing you had in mind when you worked on that bill?
110%. The Critical Infrastructure Defense Act was designed to deal with protecting critical infrastructure in the province of Alberta. We've seen rail blockades, we've seen highways be blocked, and that's exactly what the intention of the bill was, to provide law enforcement with greater tools to deal with illegal blockades in Alberta. So that was what the intention of the bill. It's up to law enforcement on the ground to make those strategic decisions as to how they implement the law in Alberta, but that was the intention of Bill number 1.
And do you have a follow-up, Steve?
I do. Just curious on that. Do you believe we're sort of at a point where that should be implemented regarding that blockade and that protest?
You know, right now, I'm going to defer to the law enforcement officials that are on the ground there. Again, at this stage, we defer to the law enforcement professionals that are there on the ground dealing with the situation.
Operator, can you put through our next question, please?
Klenawski, Alberta Today.
Hi, this question would be for someone with a depth. I'm hoping you can explain, like on 5, what a living lab is and what you mean by new diagnostic technologies. Like what sorts of things are we hoping to see come out of it?
Thank you for that good question. What is a living laboratory and what are new diagnostics? 2 really great points. So when you develop a new technology, you face a bunch of problems that come along the way. Some of those start very early on. We come up with a new concept. The concept has to be tested. It has to be proven out. And then longer term, what you have to do is you have to take the technology and bring it to a healthcare setting and make sure that it operates when healthcare professionals work with it. It operates with real-world patient samples, and that is something that can operate safely, efficiently, and cost-effectively in a real-world laboratory setting. So the living laboratories provide that unique environment that gives a really critical feedback for those healthcare innovators to refine their projects before they bring them up to Health Canada and before they go out into the real world. So that's the goal of the living labs, is they provide that environment that enables these really critical feedback from our healthcare professionals. And then what does a new diagnostic tool? Well, there's an immense gap between the tools that are used at the front lines of healthcare and the technology that's possible on the innovation scope. There might be a 10 or 12-year gap in technology between those 2 spaces. And so one of the things that the ADEPT program will do will close that technology gap between the things that are state-of-the-art for those of us in the research environment and those are things that are state-of-the-art in the healthcare environment. And by doing this, we're hoping to shorten the length of time that's necessary for the new emerging technologies to make their impact in the healthcare environment.
Do you have a follow-up, Catherine?
Yeah, and so obviously one of the goals for this is commercialization of research, and I'm wondering what the agreement looks like. If you come up with these tools that it will eventually be sold everywhere, does some of that go back to the province? Is it Alberta Precision Lab and Diagnostics get to keep it? Like who benefits from the commercialization?
Great question. And so actually commercialization is a critical part of the success of any healthcare concept, health diagnostics concept. Without having a viable commercial vehicle, you can't bring your technology through Health Canada, you can't get it manufactured, you can't get it distributed, you can't get it supported. You have to have real-world companies that are supporting this. The problem is when you try and develop a project as a small SME in Alberta or anywhere else, there's an immense barrier to getting your concepts from early stage into implementation. That's a lot of what ADEPT is about, is connecting the innovators with both the capital support, business development support, and also like this immense advantage of having access to an entire province's worth of healthcare samples can give our Alberta-based companies a multi-million-dollar edge when competing with multinationals. So, to answer your question, the ADEPT program is wired to bring investments in two ways. One is to give our Alberta-based companies an edge in competing in the global marketplace, and the other is to ensure that our SMEs are competitive when they bring their projects out, and they're able to get faster through regulatory approval process. So it benefits Albertans, and our intention is to have Albertans benefit from this healthcare first and have the greatest edge when they bring their products to market.
Operator, can you put through the next caller, please?
Evan Nimick, CTV.
Hi there. Question for Minister Schweitzer. Minister, I'm wondering your reaction when you see images like your colleague Grant Hunter joining the protest, the blockade at the Coutts border. What's your reaction to members of government joining these events that you've decried?
Good question, and I just want to reiterate the Premier's condemnation of the blockade there at the border between Alberta and the United States. You know what? This is going to be an issue that our caucus needs to talk about. I think disappointed that Grant Hunter made the decision to go there and participate in that illegal blockade. To my earlier comment, that's exactly why we brought in place the Critical Infrastructure Defence Act here in Alberta, to make sure that law enforcement have the exact tools available to them to deal with law enforcement. Our government believes in the rule of law, and we support the law enforcement professionals in our province that have to go there and implement the rules of law in Alberta.
Do you have a follow-up, Kevin?
Yeah, I'm wondering, Minister, do you think Mr. Hunter should be able to sit in caucus still?
Again, I don't want to speculate on that. That's a decision that caucus needs to make, but I'm looking forward to hear Grant Hunter's reasons for being there.
All right. Thank you, everyone. That brings us to the end of our questions. Have a great day.